Let's get into the whole coronavirus thing because it's getting very worrying. You know, it's a global medical crisis now. Concerns are spreading over the increase, and there was a new case in Wales yesterday. There was one in Northern Ireland. It's reported that 50 British guests at a hotel in Tenerife who were being quarantined have now been released despite the fact that they could still be carrying the virus. So what would happen to them when they land in the UK?
Well, that's a scary thing. We can go live to our reporter David Blackmore now, who's outside the H10 Hotel in Tenerife. What's the situation now, David?
Yeah, so we've got the 50 Brits here who are part of the 130 that are said they're going to be allowed to leave. The Canary Island authorities have said they're safe to leave because they checked into the hotel after the Italian doctor and the wife who were tested positive for coronavirus had already left the hotel. Bit of a strange one, really, given that they've been here for a few days, potentially mingling with the other guests who may be positive for coronavirus. But it's all a bit confusing here at the moment because nobody has actually left. The Foreign Office are saying they're seeking clarification. And certainly at the moment, there hasn't been anyone that's left this resort. However, as you can probably see behind me, there are these 3 containers, mystery containers, that have appeared overnight. What do they mean? Does this mean that some of the residents are going to start to leave here? We don't know. I mean, it's all been quite confusing almost from the very start when they got here on Tuesday and they said that they were going to be on lockdown. They couldn't leave their room. However, on Wednesday, we've all seen the pictures of them around the pool, eating with all each other in the buffet-style restaurant where they're mingling and sharing utensils, which does seem a bit mad if you're trying to contain coronavirus. And of course, last night we got the announcement that some of them could leave. There is a rumour that there was a poster displayed saying that information, and that poster's now been taken down. The Foreign Office at the minute are saying they're not looking to deploy a plane to pick up people and take them back to the UK. But as things stand, the 50 Brits are still very much inside.
You see, well, you could be in a situation, David, where no one wants to fly them,
well, that's
actually.
Yeah.
And what about you being there? Are you worried at all?
It's been interesting. The hotel that I'm staying at is about sort of 20-minute drive down the way, and there are hand sanitizers in each room to put it on. I've not seen an awful lot of people use it, and I guess like here as well, it's all inclusive. It's people sharing utensils, and you do question it as you're going alongside somebody and you're picking up the same utensil that they're picking up. You know, do I need to be sanitizing my hands after they've used it? You know, what are you doing? And it's interesting as well, just everything that's coming out of this resort, that it could very easily spread. And that is a concern for some of the resort members here, that actually it could be spreading worse than it was on the Diamond Princess cruise ship in Japan, only because the self-isolation and quarantine doesn't seem to be being enforced here.
OK, David, cheers. Thanks for that.
Thank you very much. So obviously the mood in the hotel, as you can imagine, would just, well, I don't know what you'd be thinking. We can go live now to join Rebecca Lunt and Mike Phillip, who are inside the hotel. Good morning to both of you.
Morning.
Morning.
This just must be, I mean, it's the unthinkable, really, going on holiday and this being the result of your trip. How are you both?
Yeah, good. Things are good. I mean, it is what it is. The sun's out, so I think a lot worse of places to be locked up.
Yeah.
But the thing is, I was reading about the pair of you this morning, and obviously this was a lovely trip away for both of you. You went out with your friends, I think, on Monday for dinner and drinks. You get back to the hotel early hours of Tuesday morning to sort of find police outside in a whole lockdown situation. Am I right, Rebecca, by thinking this is your first trip away together without your 6-year-old daughter?
Yeah, that's right.
So
She's at home with her parents.
This, for you right now, must be extremely difficult.
Yeah, you could say that.
Yeah. Mick, what would have happened if, when you arrived back in that taxi, you hadn't have gone into the hotel? You hadn't have gone back in, you'd have said to the guys, no, actually, we're fine, we're not going back in there.
I did actually try that, but the hands and pistols came out and they said I had to go in. I didn't want to come in, believe you me. I said, I'm not going in now. I should have got back with my friends. In hindsight, I would have stayed in the taxi and gone back into town.
Right.
So that wasn't an option for you then. So what about... So how does this disrupt your life? I mean, we've heard, you know, your family, you're away from them. Have you heard when you're going to leave today, or are you going to leave? Do you know anything that we don't?
As far as I know, we've got a 14-day lockdown. I think we're in quarantine till the 9th. So hopefully after we've done our 2 weeks, that'll be it. That's what the feedback we're getting.
And is it basically normal service in the hotel there?
It's hand sanitisers, face masks when you're socialising with people or going to get food. But you can go down to the swimming pool, spend the day at the pool, go and get your dinners. The bar's open, you go and get drinks at certain times. So yeah.
As far as a lockdown, it's pretty much that you can't leave the hotel. So you can use the facilities, you can use the pool, you're eating communally.
Everything's normal, isn't it?
Yeah, everything's pretty normal.
But you're not shaking. You're not shaking hands and hugging people or anything, are you? Keeping your distance.
There's no hugging going on out here. No way.
Guys, thank you very much. Stay well. That's the main thing.
Eamonn.
Yes, mate.
Can I just say one thing? I'm really looking forward to get home and have John Palmer's Big Mouth Burger.
John Barrowman's what?
John Palmer. He's got a burger bar called the Big Mouth Burger in Peacehaven. That's what I'm looking forward to getting home and having.
OK, my friend. Good. You
enjoy that. You deserve it.
You.
I'm so confused.
Why did he associate me with a big burger? Why
That's a very good point.
Yeah.
He didn't want to tell me that, did he?
No, he didn't want to tell me that. No, there we go. In the studio, we've got employment lawyer Danielle Parsons. Emma Kenny, our psychologist, is here as well. Danielle, what about people like Mick? Mick's, I think, a self-employed builder, and Rebecca there, and anybody who's going into self-isolation here? What are their employment rights? What happens to them? They're going to lose a lot of money, are they not?
Well, they are indeed, particularly if Mick is self-employed.
Yeah.
I mean, he could look into whether or not universal credit is available. He could contact the DWP and see if he's entitled to other benefits. But if you're self-employed, that means you're self-employed, and it is very unfortunate. But you're not going to be entitled to any statutory sick pay because you're not an employee.
Pretty much the same with every sort of self-employed situation.
Absolutely.
And what if you are an employee?
And if you are an employee, what I'd suggest you do straight away, and before you do anything else, is maybe have a look at your contract of employment, have a look at any staff handbook that applies to you, work out what your entitlements are. If you're not clear about what your contract says about your entitlement to sick pay, then check in with HR and ask them about the situation. But in terms of statutory sick pay, after 4 days, you should become entitled to that. And provided that you're paid over £118 a week, then you should be able to claim that for up to 28 weeks.
Would that apply? You see, there's going to be a lot of people watching us who increasingly their children are being sent home from school and they're in self-isolation. And as a parent, you're going to have to be there with your child. Would that apply to them?
Well, no, it wouldn't. If you're an employee, then you are entitled in emergency situations to time off for dependents. So that would cover like childcare responsibilities if you're dealing with children at school and the school is closed down. It would also apply to maybe elderly relatives that you have caring responsibilities for. So what I'd suggest again is check your contract of employment, check the staff handbook, speak to your employer about it. But it could be that there's no entitlement for you to be paid for that time off. And it could be that it's limited to what is reasonable in the circumstances given what's going on. And it could be that you decide, actually, I do want to be paid for this time, so I'd like to maybe take annual leave instead, or you could think about working from home, perhaps.
Right. Okay. We sit here and we convey all this sort of news, and it sounds a bit scary. None of us are really sure how scary it is, but certainly if you're...
It's the unknown, isn't it?
If you're 5, 6, 7, 8, it's going to sound really scary, Emma.
Yeah, the thing is that young people at the moment, and actually teenagers are proving to find this quite disturbing as well.
Yeah.
It's not just really young children.
Probably more so.
Because they're online and everybody's looking at headlines, aren't they? But actually what you need to do as a parent is, firstly, your children respond to the way that you react. So if you tell your children they're safe, then they respond to that very acutely. If you, of course, are stressed, don't have an engaged conversation with them during that period. Secondly, inform yourself. I've informed myself, so I know statistically my children are really not at risk. They really aren't. And I actually know that most of us are not at risk.
So, for example, my daughter, my eldest, is 6.
Yeah.
I actually haven't mentioned the coronavirus, and that probably is the wrong thing to do. I don't know.
Listen, I don't think it's the wrong thing to do. I think as a parent, you've got a subjective experience. You know your child better than I know your child. What I would say is if they're going to see any of these headlines, if they're going to have any exposure, you need to have a conversation with them about it. And one of the things that you can do is if they start talking about it, ask them what they know. Because what you don't want to do is go, right, let's just equip you with all the statistics here and all the information. Take it from their level. But when you've got a teenager, for example, you've got to get real with them. Be authentic. Talk to them about the statistics. Be honest about hygiene. Because actually, I think a reminder about hygiene is pretty cool. Well, certainly my own children need a reminder regularly about hygiene because, you know, washing hands is something you have to instill in children. But I think you have to remove the fear. We've got this massive hygiene issue. We've got this massive coronavirus constantly thrown at us in the press. But how is that translating? Because the horror stories that you're kind of reading aren't translating into statistics. And I think that what we need is that honest conversation to say, you know what, as long as you take care of your hygiene, as long as you recognise that this isn't going to affect you, because under 20, there's been one death in the world. In the world. You know, you're talking about the older age groups. That's understandable. You know, kids are going to be worried about the grandparents. That's an honest conversation to be having with them. Because obviously you might want to isolate them from older people during that period of time if they're affected.
Right.
But honestly, I think the thing about the British public, with respect to the guy you've just seen there, if there was ever a statement to be made, it's somebody going, well, it could be worse. And I think that that's how we are. I think the drama for many of us is minimal. And I think for those of us who feel very stressed about it,
except,
really
let me ask you
headlines.
too, are you changing, all of us, are we changing our habits? I mean, are you shaking hands? Are you hugging people? Are you... Or do you find you've changed, Danielle?
Well, not for me. I mean, the risk of coronavirus at your workplace is actually low to moderate. So I haven't really made any major changes, but I have been washing my hands more. And obviously, I think everyone's more alert to catch it, bin it, kill it. When you're sneezing or coughing, use tissues and put the tissues in the bin and so on. But, and certainly I've noticed when I've been sneezing on the tube recently that people have been, you know, really startled.
Oh, goodness me.
I think I agree. I think it's just very conscious of washing hands. They say wash your hands 20 times when you're actually doing it. That's the way to do it. Use soap. But I'd also say that I'm kind of quite pragmatic in the fact that I think that genuinely most of us are going to be OK no matter what. And just keep that frame of mind.
Thank you very much indeed.
Thank you very much.
Very good.
And Alice is going to be here a bit later on.
Don't touch me, don't get...
Yeah, actually. Can we have a little line drawn over this sofa, just in case? I'm sorry.
Yeah. So the actual washing business...
Alice is going to teach us how, if we're washing our hands properly, because we all sort of go to the loo and wash our hands afterwards, but are we doing it right? That's the question. She'll be here a bit later on.
And are you doing it for long enough? I mean, that sounds, are you doing it right? There's just like a bit of soap and water and whatever. But actually, there's a minimum... What were you telling me today? You have to
Apparently, you're supposed to sing Happy Birthday twice.
Happy birthday to me.
I'll let you do that, and I'll read this. In just a moment, Martin Lewis is here to help you save some money this week. That's right after this break. One more time.
Happy birthday.
See you in a bit.